Hello, and welcome back to What That Means Is. We're at episode number 8.
Yep.
And we're ready to rock and roll with it. Now, we just want to say one quick thing before we get going into our discussion of episode 8. We wanted to just draw attention to pages 49, 50, and 51 because there are some really helpful infographics there, and Ken's going to describe them to you.
Yeah, and just because we've got maybe have some new viewers with us, what we're talking about is this report. And up on the screen, you can see where you can get a copy of this report. It's called The Investigation into Criminal Allegations Concerning COVID-19 Pandemic Response. You can go to this website, thetruefactsc19.com, and you can download this anonymously. You can download it for free. Nothing on this site costs anything. You can also subscribe to our site if you wish, and you will get regular news and blog posts. We cover a variety of subjects, not just the report, but we talked one of our latest blog posts was about the municipal elections that just completed, and you'll be shocked at what we found out in looking at those numbers. And anyway, so
It's amazing what you find out when you do a little digging with statistics.
and you start asking.
Yeah.
And again, being consistent throughout. We don't manipulate the numbers. We don't leave out inconvenient truths, as someone else once said.
What do we like about these infographics, actually?
So what we've done is, we've spent 7 episodes now going through all kinds of things in detail in this report, and it might start to become a little overwhelming. Where was this? Where was that? So what we have done is, in the report, pages 49 through 51, actually go through in a very easy to understand graphical format a lot of the stuff we've talked about. So the first one on page 49 is called Did You Know? What Are the Odds? And you can see that it talks about the different age groups we examined. It talks about the causes of death, overall causes of death. It compares the statistics. Don't want to use that word, the S word, as we like to call it around here. But we use the numbers and the mortality rates from 2019 to 2020, and we show you in black and white what the Government of Canada is telling you that your risks of mortality are due to various causes and due to COVID-19, comparing 2019 to 2020.
Once again, we're taking Stats Canada's numbers and we're unpacking those numbers and laying them out for you and for us.
Exactly. We haven't adjusted them in any way. It's just what they are. The second one on page 50 has got to do with mRNA vaccines and pregnancy. And this is something that's extremely important.
Very important.
We did a whole show on it. And here, it's got the facts written down. It gives you the statistics in accordance with Statistics Canada. It tells you about the leading causes of death for women in that age range. And everything, or a lot of the things, a great deal of what we talked about in the other episodes are here on this one page. Colorful. It's beautiful. It's easy to download, easy to understand. And then the last one of the infographics here, and there are more later on in the report, and we will get to those in future episodes. But the last one has to do with, it's on page 51, it says, Did You Know? And it's a whole fact sheet about mRNA vaccine safety data. And some of the things that are in here are just incredible. There's some things in here that are listed that we haven't talked about yet, but we're going to in a future episode. But, mRNA vaccines, number one, are new, have never before been used in the general population. They have never been used in wide-scale testing. mRNA vaccine does not prevent you from getting COVID. mRNA vaccine does not prevent you from transmitting COVID.
Where are you getting this from? Is this where did you hear this?
This is from Pfizer.
Okay.
There was just a recent, and by the way, keep in mind this report was written in February and March last year, but even more information's coming out since then. In the European Parliament, they questioned one of the top executives for Pfizer a few weeks ago, and they asked, "Does it prevent transmission?" They said, "We never tested for that." And yet they were telling you, what are the ways they were...
You're just getting pushed and pushed and pushed to take this. All ages getting pushed. Pregnant women getting pushed to take the vaccine.
Yeah.
These are really great go-to study cheat sheets in a way to have these stats and these figures right in front of you.
Yeah, and you can go to the website, by the way. You don't have to figure out a way to copy them out of your copy of the report.
Sure, yeah.
If you go to the website, there's a yellow button on the side. There's a picture of the report, and then there's a whole bunch of buttons. I can't remember how many, 10 or a dozen. And you can read down on those, and you can download what you want. There's a button that says infographic pages, and this is what you get. It
And you
just
can actually
downloads.
save that page to your phone, so you
Oh,
can
yeah.
have quick access to it.
Absolutely.
Yeah.
There's all kinds of things in there. There's over, I think there's several thousand appendice pages that go with this report. There's a button you can push and you can download all
And you
of
can
them.
have all 1,000 of them on your cell phone.
And there's all kinds of other things in those appendices. There's business cards
Right.
that we did with a QR code. So
Yeah.
you can hand those out and a person can just scan it with their phone and it downloads the report, again, anonymously and for free into their phone.
So, Ken, without any further ado, maybe we should launch into what we're talking about. So, I'm Rosalie Drysdale, and this is Ken Drysdale.
And I'm the author of the investigative report.
Exactly.
And I'm filling in as guest host this episode for Chris Riddell.
And he's filling in to disclose and to take apart the very investigative report that he wrote. So, nobody better than him because he knows the material so well. Okay, so page 52, 6.3, harm caused by mitigative measures. So, again, we're doing this all based on, and I'm sorry if I kind of sound like a broken record, but I think it's really important to continue to emphasize that these stats that we're working with here, all the numbers, are all from Stats Canada.
Yes.
And so what we're doing is we're looking at it, we're unpacking it, we're lining it up to make it make sense for us and make it make sense for you folks at home, because we want you to know the truth. We don't want you to be afraid of discovering the truth and researching the truth. Don't be afraid of what you find out. You have to know. That's why we called it the True Facts C19.com.
Yeah. And we've given you links to this information, not from some crazy blogger page in Paraguay, but we've given you the links to Statistics Canada's own information that you can click on and you can dig around and find it for yourself.
Not that we have anything against Paraguay.
No, we love Paraguay. Now, so what we're going to do here is we're going to talk about the harm caused by mitigative measures. And again, what we're doing is we're not going to give you opinion evidence here. What we've done for a baseline is we've used what's called the
Canadian Pandemic Influenza Plan 2006.
There you go. Thank you, Rosalie. That's a mouthful. All of this stuff is a mouthful. Now, this report, by the way, the senior author of this was
Stats Canada.
Teresa Tam.
Oh, whoops, maybe you shouldn't have asked me.
So Teresa Tam was the major author of this.
That's right, yeah,
There's
yeah.
actually 3 or 4 pages of people who authored it, including a lot of the provincial health officers who are now in power, or
Right.
hopefully soon to be out of power.
Yeah.
So they wrote this report. It's 616 pages long. It's in the appendices. You can search it out if you wish, and you can download your own copy, but there is a full copy of it as an appendice download on our website.
So again, to reiterate, this is a thoroughly researched investigative report. I mean, there are how many pages in your appendices altogether?
Thousands. There's thousands.
There you go.
So again, we're not going to use anecdotal evidence. What we're going to do is we're going to look and see what Teresa Tam was saying and all her other people who were involved in this report
Way back in 2006.
in 2006, and what they said there, and you can be the judge of whether you thought it made any sense, and what they did here.
I just want to say that this plan was put together in 2006 and in many parts of the world as well. But the most important recommendations of the plans were never implemented. I wonder why. I mean, I'd really like to know why.
Yeah.
And equally as important, they were in fact discouraged, or even, it says outlawed, yes, outlawed, but mandated, which really isn't anything that was mandated. This was not laws, okay? These were just like arbitrary things that came down, like orders from headquarters that were really not. I mean, they go against our Charter of Rights.
But here's the rub, you see. We're not just talking about mandates in here. We are talking about outlawed things. For instance, antiviral treatments. You see, the 2006 Canadian Pandemic Plan actually recommended that the government should stockpile certain antivirals. And I'm going by memory here, and
Oh,
I've,
this
I've been
is
saying that
interesting.
for a while, and perhaps I need to go back and confirm, but I believe the government spent somewhere around 29 to 30 million dollars stockpiling specific types of antivirals in case this happened. And then they outlawed those antivirals, and
They
you couldn't,
outlawed them.
yeah, and you couldn't use them. Doctors are losing their licenses for trying to treat the COVID-19 with anything but the experimental vaccines. And we've talked about that in some detail already about why do we call it an experimental vaccine? Is that an opinion? No, it's a fact. And if you go and look at some of the other episodes here, you'll understand how and why that is.
So it's vaccine or hospitalization on respirator and remdesivir.
Yeah, yeah, or Comirnaty,
Yeah.
or one of the other ones that they've got. So what you're going to see, this part of the report is a little different than the other parts of the report. What you're going to see, and I've shouted up on the screen here, on page 53, right at the very top, you see a black a box, and there's kind of a mauve-colored 2.5 response. And whenever you see those, what that is, it's just a straight screen capture, word for word, from that section of the Canadian Pandemic Plan. So that's what we're using to evaluate whether they should have done something. Did they do something? How does it not jive with what they recommended? And by the way, I just want to point this out as well. It's amazing to me. You know, the other day I ordered a copy of my birth certificate from the province of Manitoba. Now, I would think that certificate's mine, and I would think that I've been paying millions of dollars of taxes all my life. But you know, they charged me $60 to make a photocopy and mail it out to me. So let's see, a photocopy is 21 cents color. A stamp is whatever a stamp is now. I don't even know, 60 cents, whatever it is. An envelope's probably another buck. So, and then you throw in somebody's time for 5 minutes. It should have been $5 or $10, but they charged me $60. Okay, that's one piece of paper that I kind of own. They didn't have to do any research on. They pushed a button on a computer, right? Now, why am I telling you that? The Canadian Influenza Pandemic Plan, 616 pages. There are, I think it's 3 or 4 full pages of doctors and the like who worked on it. What do you think that cost you? How much do you think we spent? How much money did Theresa Tam and her group spend on that 616-page report, which you will see in a minute they just ignored? I can't even guess at that.
Oh, I thought you knew.
No.
Oh.
I'm afraid if anyone out there wants to do some research and let us know, but I will bet you money that it's hidden in all of the budgets that were taken out. The other thing I wanted not to let this get lost in the shuffle here, Rosalie mentioned that similar reports were done worldwide. The initiative from this came from our old friends, the WHO, the World Health Organization from the UN, and they planted the SEED report, which each country, including Canada, United States, Great Britain, kind of rewrote for their own
Are you
purposes.
saying that's what happened way back in 2006
Yep.
when the influenza plan was? Oh, so that was somehow instigated by the WHO.
Yes.
That's interesting.
Okay, and now right on the very first page, page 53, right in section 2.5 of the pandemic plan, bullet 3. The use of antivirals to decrease the risk of transmission from the first cases infected with a novel virus and their contacts will be considered as a strategy to contain or slow the spread of the novel virus. So, did they do that? Did they use any of the antivirals that they stockpiled and you paid for?
I'd like to know what those antivirals were.
They're actually listed in the pandemic report. And just like everything else in medicine, it has a name about this long and it's in Latin, and I wonder why that is.
Is that also in the appendix?
It's
the
in
appendices?
I can't remember if it's appendix 1 or 2, but it's the Canadian Influenza Pandemic Plan and it names them.
Okay.
616 pages, folks.
It's all there if you want to find it. It's all there. Ken's done the work for you.
Yeah, now, what about, that's just kind of a little primer into this. Now let's talk about masking. And you know, you heard all kinds of things about masking, and we actually put some studies in here from CDC and stuff. But again, if you turn the page 54, you'll see there's some of those pesky little boxes that are excerpts taken directly out of the Canadian Pandemic Plan. And right the very first one, and I give you the reference there because, by the way, the Canadian Influenza Pandemic Plan is not an easy thing to read. Not because the words are tough, but because the organizational structure is Terrible. And so you really have to look at the references I put at the top. The first one is Appendix F, Section 2.6, and I've had folks who came to me and said, Ken, we can't find it in the report. And when I was going through this and writing our report, I muddled my way through it and I kind of forgot about it. But then when someone asked me, where did this come from? I can't find it. I said, well, the reference is right there, but I went back and started searching, and I had a hard time finding it.
Is that right?
Absolutely. Now, all of these people, the hundreds of people that wrote this and all of the reviewers, they couldn't have made it in a more simple to understand, readily readable format. Nope.
I kind of feel like the point of this whole exercise is to confuse the recipients.
Yeah. So so the very top box, again, it was taken right out of the Canadian Pandemic Plan. And it says, although there is lack of evidence that the use of masks prevented transmission of influenza during previous pandemics, in the early phase of an influenza pandemic, it may be prudent for healthcare workers. That's what HCW means, healthcare workers. Doesn't say the public, doesn't say kids going to school. It says healthcare workers to wear the masks when interacting in close face-to-face contact with coughing individuals to minimize influenza transmission.
To minimize, not necessarily eradicate. And I like the term lack of evidence in the first line.
Yeah, and the very last line of that paragraph says, there is no evidence that the use of masks in general public settings will be protective when the virus is circulating widely in the community. So, did Theresa Tam follow her own recommendation on that? Was this COVID-19 such a special item? There's actually parts of the report, of the Canadian Influenza Pandemic Report, that talk about the characteristics of the pandemic that they were prophesizing about or planning for. And it's to the T what happened here with COVID-19. So then the next part of it, and again, I give you the clauses there. It's 7.4, use of masks by well individuals. So let's see. May decrease exposure to large droplets containing the virus. These are the advantages. May decrease exposure, to large droplets. In other words, if somebody sneezed on you. The second advantage, psychologically reassures people that they are taking measures to prevent infection.
Can I just say that they didn't think anybody research all of this?
No.
And there's the fear mongering was just never to be seen before. I mean, there are still people, bless their hearts, who are riddled with fear, who are out there wearing masks in the day and outside, walking down the street, wearing masks because of fear. They did not think that anybody was going to look into this.
Well, now that's the advantages. They gave two, right? It might decrease large droplets, and it psychologically might reassure you you're doing something. Now there are 6 disadvantages. Disadvantage 1, hands and other surfaces may be contaminated when mask is moved. So, in other words, if you touch your face because it's itchy, or you take the mask off when you go in the car, or you put it back on again, you've just infected your hands. May cause panic if availability of masks is limited. Remember how there was a shortage of masks and people were freaking out? Well, that came true. Let's see. Public purchase of masks may limit the availability of masks in healthcare settings. That came true. Remember, they were telling you stop buying it. No, Fauci was coming on. Now, he's an American. We're talking Canada. But he came on and told you at the beginning, oh, masks don't do anything. Don't buy them. And then he later said he only said that to protect the supply. So that came true. Let's see.
And then he proceeded to wear 2 and 3.
Yeah. Not all members of the public can afford to purchase masks. If recommended by public health authorities, there could be an expectation that they will be publicly funded and provided. So they didn't. One of the disadvantages is the government might have to pay for them, and they didn't want to pay for them. So the next one, number 5, it is not feasible to wear masks constantly for the duration of the pandemic. So they started out telling you, what was it, 10 days, or 1 day, or something to flatten the curve? 2 weeks to flatten the curve. And then they made you wear them, little bitty kids wearing them in the schools. And I'm going to get to that. And then it says the last point, last disadvantage, use of masks, apart from other infection control practices, is of limited effectiveness and may provide a false sense of security. So let me get this straight. with everything that I just read you from Teresa Tam's report, we took little kids in grade 1 who are, trying to figure out speech, they're trying to figure out interaction, and we dehumanized them by putting a mask on them. We made them into an it instead of a them or a he or a her.
You can't recognize a person smiling.
You can't. The kids are watching each other how they're talking. They can't. They lost that. They some of the kids didn't recognize their friends when this stuff got taken away.
There's so much affirmation that is expressed through your face.
Absolutely.
I don't even know what the percentage of that is coming through the person's face. There's also touch, which they weren't allowed to do either.
No.
So much validation, affirmation. Those things are so important to the development of a child, and not only we're talking about children now, but to the sustainability of relationships and amongst adults.
Yes.
We need each other. We need to be able to communicate. All these things were reduced dramatically. I mean, half of a person's face, this is the glory of who you are. You can't, and oh my goodness, you better keep that thing over your nose. I mean, can't breathe, can't smile.
Yeah. And you know what? You were in a restaurant and you could take the mask off when you were sitting down, but if you needed to go to the bathroom, you had to put it back on again. If you were a kid in school, you were sitting down, but you had to wear a mask sitting down. Mm-hmm. Oh, by the way, in those little life-saving circles on the floor of every store, CDC admitted there was nothing. There was no testing, no scientific basis for that 6-foot spacing stuff they did to us.
So what we're illustrating now is we're saying the damage that was done by these behaviors and by these mandates, and there was no substantial evidence that they made one hill of beans of difference.
Actually, it was the other way around.
It was the other way around.
Page 55, and this is all about masks still, by the way. It says conclusion, and again, this is taken right out of the Canadian Pandemic Plan. I can read the whole thing. I'll read a little bit of it. This measure, talking about masks, is not feasible or sustainable on a population basis. It is not likely to be effective in reducing disease spread in the general population, and therefore is not recommended. And then it says right at the bottom, you can read the whole thing yourself, not recommended as a community-based intervention measure. And what did we do?
Wow.
And then going on from this, the next bunch talks about our good friends from the South at the CDC and what their own reports were telling them. They had bamboozled a lot of people by putting out reports that were based on the effectiveness of masks in the operating room for doctors. And there was disclaimers in there, small disclaimers, and it's all in this report, by the way, and it references those CDC reports. You can go look at them. But there was a little disclaimer in there. Oh, this has not, it's just like when you're watching those drug commercials, Rose, on the TV, when they got these two people walking in the sunset, and you wonder, what the heck is that all about? And then it goes, we're going to die by this. This was like that. But the references are there. It says, putting on masks do not support a substantial effect on transmission. They have a guidance paper on 2019. Then they have, as I said, the fine print about the reasons it doesn't apply to people like ordinary people. They also even had a separate report, by the way, that talked about how important it was to have a proper fitting, proper tested, and proper wearing mask on in the operating room for doctors. And can you imagine, Rosalie, could you imagine the 7-year-old in elementary school sitting there with a runny nose? He's got a cold,
Yeah.
which of course there weren't any during this pandemic, but they've got a mask on and their nose is running. And so every few minutes they pull that down or they wipe themselves with their hand and they,
I mean, it's worse.
It's worse.
It's worse than what
Absolutely.
it would be if you were. If you had a runny nose, you wipe it with a Kleenex. You go wash your hands. I mean, look, we were always all for keeping your hands clean. You go to the washroom, wash your hands.
Yeah.
Make sure you shake hands with people. If you shake hands with a lot of people. Wash your hands or put the disinfectant on. All that stuff. But you get the mask, you get that all. It's just like a mess.
Yeah. Well, we've told you what the Canadian Pandemic Plan says with Teresa Tam and all of her cohorts. Mm-hmm. We've given you links to the CDC now, but guess what? That's not enough. On page 56, we're going to talk to you about the WHO. What did the WHO say about this? They actually did a study. called The Efficacy of Non-Pharmaceutical Public Health Measures. It was done in 2009. There's a link there. Page 26 of the WHO report, they state, and it's in the little oval box there, overall result of evidence on face masks. 10 RCTs were included in the meta-analysis, and there is no evidence that face masks are effective in reducing transmission of laboratory-confirmed influenza.
Well, looky.
That was it. So now you've got the public health officers in Canada, Canada Health, CDC, and the WHO telling you that there's no evidence that masks
Well,
do
Fauci
anything.
was saying that right from the start, but then he kind of changed his mind.
Yes. Now, page 57, I reproduce a whole lot of stuff from the studies there, and you can read them yourselves.
Please do.
There were studies done, also other studies done that studied the number of studies and accumulated, believe that or not, and they accumulated all the information, and that's all there on page.
Well, that's kind of interesting. Studies to study the study, but yet they didn't do any of it. They did the opposite.
Well, on page 57, just right there in the middle, it just caught my eye as we were
Okay.
talking, and it says this is from the 2020 report titled "Non-Pharmaceutical Measures for Pandemic Influenza in Non-Health Care Settings," CDC. Right in the middle, it starts with disposable. Disposable medical masks, also known as surgical masks, are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. There is limited evidence for their effectiveness in preventing influenza virus transmission, either when worn by the infected person or for source control, or when worn by uninfected persons to reduce exposure. Our systematic review found no significant effect on face masks on transmission of laboratory-confirmed influenza. So if there was no evidence that they did any good, but we all know there's significant evidence that we talked about, just plain, ordinary, normal, logical evidence that they did harm, then why in the heck did we do it?
Do you know, I was speaking with a chiropractor a little while ago, and she told me that she and some of her associates have been discussing, and they have never seen such a high instance in cardiovascular difficulty because people just couldn't breathe properly, and it's evidencing in their bone structure, in their posture, in their whole categorical health, because they were, they couldn't get fresh air because they're breathing in their own carbon dioxide.
Yeah. I mean, and again, we're just about wrapping up for today. I think that's a lot.
Yeah.
But I do want to point out on page 58, remember we talked about those studies, and the Canadian pandemic study was in 2006 and it's been updated along the years. There was a CDC study that we looked at in 2020. There was a WHO study in 2019. Well, guess what? The CDC did a study February of 2021 titled "Maximizing Fit for Cloth Medical Procedure Masks." Now, a lot of people, and there's been studies on this, don't ask me what they were, but somebody told me there were studies, that people only read the headline of a newspaper article or a magazine article, and then sometimes they read the summary. So if you were to do that in this case, so I just read you what it's titled, and then the summary, it's just copied out of the CDC report. It's a brown box. It says summary. What is already known about this topic? And this is about medical procedure masks. Universal masking is recommended to slow the spread of COVID-19. Cloth masks and medical procedure masks substantially reduce exposure from infected wearers, source control, and reduce the exposure of unaffected wearers.
So that was the heading? That was the first paragraph?
That's in the summary.
Okay.
That brown box is the summary of this report.
Okay, gotcha.
And then it says, what is added by this report? CDC conducted experiments to assess 2 ways of improving the fit of medical procedure masks. Fitting a cloth mask over a medical procedure mask, blah, blah, blah. And then it says, what are the limitations? These experiments highlight the importance of good fit to maximize mask performance. There are multiple simple ways to achieve better fits of masks for more effectively slow the spread of COVID-19. Now, the interesting thing about that's the summary. So if you read the headline and you read the summary, what would you think? You would think that CDC has changed its mind. It flip-flopped.
But if you actually look and you go down where it starts,
The study was a strictly laboratory-based and theoretical study under controlled condition in a laboratory that does not represent what is actually achievable in the real world
In the real world.
by untrained non-medical personnel using their masks over a long period of time. So, but then the CDC actually said, and you can see I've got it bolded, you can read the whole paragraph. It says the findings in this report are subject to at least 4 limitations. First, these experiments were conducted with one type of medical procedure mask and one type of cloth mask among the many choices that are commercially available, and were intended to provide data about the relative, that word relative again, relative performance in a controlled setting. And then I bolded, this isn't their bolding, this is my bolding. The findings of these simulations should neither be generalized to the effectiveness of all medical procedure masks or cloth masks, nor interpreted as being representative of the effectiveness of these masks when worn in real-world settings. So, is that the message that you got if you read the summary? And they don't say that, do they?
Kind of the opposite.
Absolutely, and there's more. There's much more. I keep sounding like that Kate Tell
Yeah.
guy, but it's true.
Our friend Ray.
I mean, and on page 59, there's a whole lot more there. There's a whole study from the American Institute of Economic Research, dated February 11th, 2021. With that, I think that wraps up the episode for this time. Our next episode is going to be about forced and mandated vaccinations. And there's some really interesting information in this one.
Oh,
you
boy.
don't want to miss this one.
Oh, boy.
We have actual quotes from Health Canada that they were telling you, and we're going to show you how those were lies. And we're going to go through great detail, so we want you to have your thinking caps on next time.
Be prepared.
Absolutely.
Yeah. Thank you very much for joining us. And again, we'd love to hear from you. So keep in touch with us.
Yeah, and our contact email address is on the screen, so don't hesitate. So there's your comments. If you have any suggestions for improvements in the show and perhaps in our presentation, or you still have a burning question about a particular issue,
Yeah.
just email us. We always respond.
And I also would like to know how these sessions have helped you to understand things a little better. I'd really like to hear about that too. We'd like to hear that kind of feedback. This is important.
And once again, you go to our website. It's free. It's anonymous. You don't have to subscribe. You can subscribe and you'll get regular news flashes from us. You don't even have to subscribe. You can still go onto the website anonymously, go to the news page, and you can see all of the latest posts. You just won't receive them in your email box. I encourage you to subscribe. That helps us. And we get feedback from you. That also helps us. So again, go to the website, download your anonymous free copy of the report. If you've got questions, if you feel like you should subscribe and support us, please do. We don't receive any funding from any source whatsoever except our bank accounts.
We want to get this information out there.
Yeah, and we're not in this to sell T-shirts or to sell books or whatever.
We're in this to inform.
We're in this to inform you because we have 6 kids and we have multiple grandchildren. We have 4 grandchildren, and we're guessing there might be some more on the way soon.
Hopefully.
So we're protecting our family.
Yeah.
And we're protecting your family as well. So it's a pleasure to come to your home again. Thank you very much, and we will see you next time.
And have a great day. And this is Rosalie Drysdale.
And Ken Drysdale.
Take care. See you next time.
Bye, everybody.